All right, well, welcome back. Hopefully you have consumed enough coffee. So very exciting day that we have ahead of us. And we've got a really great lineup of topics and speakers and interesting points to engage with you guys about. So we're actually going to start the day focusing with this illustrious panel on patient and family engagement in what we've called knowledge generation for care improvement, aka research. So we're going to then move into a discussion led by John Santa, where we'll talk about how we might change expectations around cost and quality for consumers. There's been a lot of discussion about that over the last couple of weeks. In particular, many of you probably saw Pauline Chen's blog. I think it was yesterday or the day before in the Wall Street Journal. So there's lots of topics to be had in terms of how we move to version 2.0 of the consumer use of cost and quality data. We're going to break for lunch at 1 o'clock, and we're going to hear, as I mentioned yesterday, from David Goldhill, who's the CEO of the Game Show Network, about his experiences trying to care for his father in our healthcare system. We're then actually going to go into a discussion around some cross-cutting strategies that can advance patient and family engagement and partnership. I mean, one of the observations that a planning committee member made as we were putting these workshops together was about the fact that there's a common theme that does tend to underlie all of these three topical areas we've been focused on. Of course, we've talked about partnership, but the other common thread is this idea of decision making. So yesterday we talked about decision making in care, but today we're going to talk really about the decision to share your personalized clinical data for improving population health through research, and we're going to talk about the decision to choose a high-value healthcare provider, the decision to use tools that would help you identify high-value healthcare providers. So we're going to have a great discussion around some cross-cutting strategies that might support that kind of information dissemination and decision making, again, through that lens of partnership. And then we're going to end with some reflections from a very diverse and very interesting set of our planning committee members on this pathway forward, right? So if you recall, that's really what we're thinking about. How do we accelerate progress in these areas by building on what we already know? So that's what our lineup looks like for the day. We will adjourn at 4:30. Lots of tearful goodbyes, hugs, things like that. And again, I'll just encourage you guys online as well as in the audience. We really do want to continue to have a robust and dynamic discussion like we did yesterday. So we have microphones, we've got email and online strategy, so please do avail yourselves of them. So I'm going to turn it over to Sue Brown Trinidad. She's a research scientist in the Department of Bioethics and Humanities at the University of Washington. She's going to moderate our panel. I will say that she focuses in her research on ethical, legal, and social implications of genomic research. She also is interested in studies, communication, and decision-making in healthcare settings, health equity, community-based participatory research, and more. So she's a terrific thought leader and member of our planning committee, for which we are grateful, and I will turn it to you. Thank you, Sue.